Hello everyone, sorry I couldn't be there with you today. I had a prior work engagement, but my name is Kayla Everett and I will be talking to you about leukemia. So leukemia is the malignant neoplasm of cells originally derived from precursor myeloid or lymphoid tissue cells. A myeloid neoplasm arises from hematopoietic stem cells and normally gives rise to monoclonal proliferations that replace normal bone marrow cells, and a lymphoid neoplasm encompasses a group of entities that vary widely in their clinical presentation and behaviors, and they originate in the peripheral lymphoid structures such as lymph. The cause of leukemia is largely unknown, and it likely differs due to the different types of leukemia, which we'll talk about later. However, it's been suggested that leukemia is caused due to disruption or dysregulation of genes that normally regulate blood cell development, blood cell homeostasis, or both. There's three types of ways a cell can get dysregulated. One is translocation, where part of the cell becomes located on another chromosome. Inversion, where part of the chromosome is turned upside down, so it's in reverse order. And the third is deletion, where part of the chromosome has been lost. You can also get leukemia through aggressive chemotherapy via a prior disease, exposure to formaldehyde or benzene, family history, and genetic predisposition, such as trisomy 21, otherwise known as Down syndrome, neurofibromatosis, or Fanconi anemia. These are just pictures of what each of them looks like if you're a visual learner. So there's 4 classifications of leukemia, and they're broken into subcategories, and they're classified according to their predominant cell type and whether the condition is acute or chronic. So lymphocytic leukemia involves immature lymphocytes and their progenitors that originate in the bone marrow and infiltrate the spleen, lymph nodes, central nervous system, and other tissues. The 2 forms of this are acute lymphatic leukemia and chronic lymphatic leukemia. The other form is myelogenous leukemia, which involves the pluripotent myeloid stem cells in the bone marrow and interferes with the maturation of all blood cells, including granulocytes, erythrocytes, and thrombocytes. And those 2 are broken down into acute myeloid leukemia and chronic myeloid leukemia. And these are just pictures of what each were to look like if you were to look at their cells. Acute lymphatic leukemia is the most common leukemia in children, and it accounts for 34 cases, or 75% of childhood cancer. It encompasses lymphoblasts, which are groups of neoplasms composed of precursor B or T lymphocytes. And in about 85% of cases, it's always the B precursor that's involved. Approximately 90% of all people with this disorder have numeric or structural changes in their chromosomes of the leukemia cells, and this dysregulates the expressive and functions of the transcription factors required for normal hematopoietic cell development. And then there's 4 types of ways that your chromosomes can have a variation due to hyperploidy, polyploidy, chromosome translocation, and chromosome deletion, which we talked about earlier. Acute myeloid leukemia is mainly a disease of older individuals, but it can be seen in children and young adults, and it accounts for 1/4 of cases. And what it is neoplasms that affect precursors in bone marrow, and it's associated with acquired genetic alterations that inhibit terminal myeloid differentiation. In this certain leukemia, there's a large form of translocation that's seen through the chromosomes. And unfortunately, acute myeloid leukemia is rather fatal for about 80% of patients, and individuals that are younger than 55 or 60 years of age, they have about a 40% survival rate, and then those who are older than 60 have less than that, and they have a 5 to 10% 5-year survival rate. Even though these are different disorders, they have similar clinical features. So the manifestation of both, they both have abrupt onset of symptoms, which are fatigue, low-grade fever, night sweats, and weight loss due to rapid proliferation and hypermetabolism of the leukemic cells. They also have increased bleeding due to decreased platelet counts, and they can have bone pain or tenderness due to bone marrow expansion. There's often an infection due to neutropenia, which is a decrease in neutrophils, and they can also have lymphadenopathy, splenomegaly, and hepatomegaly, which occur due to the infiltration of leukemia cells. Central nervous system involvement is common in acute lymphatic leukemia, and it's also common in children. If this were to occur, there would be signs and symptoms of cranial nerve palsy, headaches, nausea, vomiting, papilledemia, and occasionally seizures and a coma. As for diagnosis, it's based on blood and bone marrow studies. So you look for leukemic cells in the peripheral blood, bone marrow, and extramedullary tissue. You would also use a bone marrow biopsy to determine molecular characteristics, the degree of bone marrow involvement, and the morphology and histology of the disease. You can also use a cytogenic study, which is actually more popular, and then that one determines chromosomal abnormalities, and you can also do a lumbar puncture to assess central nervous system involvement. As for treatment, the primary treatment is chemotherapy, and if you have acute lymphatic leukemia, you have a higher rate of a 5-year survival. There's a kid at my clinical site who had this form of leukemia when he was little and they thought he was going to die, and now he's playing football and is a complete stud. Unfortunately, if you have acute myeloid leukemia, then there's a decreased chance of a survival rate. And say you don't respond well to the chemotherapy, the next option is to do a bone marrow or stem cell transplantation. So that way you still have a way to be cured from this disease. So moving on to the other forms of leukemia, the next is chronic lymphatic leukemia, and that accounts for about 1/3 of all leukemias, and it mainly affects older individuals. The age at the time of diagnosis is approximately 72 years old. It's rarely seen in people younger than 40, and it is extremely rare in children. This is caused through clonal malignancy of B lymphocytes, and is more common in the Western world. So with this disease, or with this leukemia, you can either have a very aggressive form of it, which is rapidly fatal and you need aggressive therapy, or you can have it but it not bother you, and then you just survive for years and die later due to a different disease or a different cause. If you do have a mutated form of the immunoglobulin gene, then you generally have a indolent form of this disease, which means it's not as terrible and it's not as aggressive. As for manifestation, the signs and symptoms are largely related to the progressive infiltration of bone marrow and lymphoid tissues by neoplastic lymphocytes and secondary to immunologic defects. You are often asymptomatic when you're first diagnosed, but if you have an increased lymphocyte, it's noted on your complete blood count. Once this advances, you generally start to have an increase in lymph node size, or new lymph nodes are involved. And if you have the more aggressive form of this leukemia, then you have a rapid sequence of clinical deterioration, which is characterized by an increased lymphadenopathy, hepatosplenomegaly, fever, abdominal pain, weight loss, progressive anemia, and thrombocytopenia. As for diagnosis, it looks at an isolated increase in lymphocytes and the test to determine the presence of mutated forms of the immunoglobulin gene and the expression of the CD38 surface antigens may be used to determine whether the leukemia is in the indolent or aggressive type. In order to be diagnosed with this disease, you have to have a presence of at least 5,000 B cells, which is what all of those are in the picture in the corner. As for treatment, the exact treatment depends on your diagnosis, If you have the low risk, then you don't need any treatment and you can just go about your day and your years and you'll generally die from something else. If you have an intermediate risk and you remain stable, you don't necessarily need treatment, or you could need it within a few months depending on how it progresses and if you have complications. And if you're high risk, then you need to start chemotherapy as soon as you're diagnosed. And for those who are of the younger age, if you are high risk, you can have an allogenic ablative or a non-myeloablative stem cell transplant, and that's a treatment option. And then for the last one of these, which is chronic myelogenous leukemia, it accounts for 10 to 15% of all leukemia, and it predominantly affects older individuals, averaging the age of approximately 67 years at the time of diagnosis. So this is a disorder of the pulpit hemopatic progeneration cell, causing excessive proliferation of bone marrow granulocytes, erythroid precursors, and megakaryocytes. It's believed that this form of leukemia develops when a single pluripotent hematopoietic stem cell acquires a Philadelphia chromosome. And a Philadelphia chromosome, as you can see in the picture of the corner, undergoes a translocation between the long arm of chromosome 22 and the long arm of chromosome 9. This condition is found in more than 90% of people with chronic hemogenous leukemia. And this manifestation is divided into 3 phases. So the first phase is a chronic phase, and in this, the onsets of the symptoms are usually slow with non-specific symptoms such as weakness and weight loss. The most characteristic laboratory findings at the time is leukocytosis with immature granulocyte cell types in the peripheral blood, anemia, spondylomegaly, hepatomegaly, and lymphadenopathy. So people in the early chronic stage are generally asymptomatic and they don't really have to go through treatments. If you accelerate into the next phase, it's characterized by enlargement of the spleen and progressive symptoms. Splenomegaly often occurs, and there's an increase in basophil count and more immature cells in the blood or bone marrow, which confirms transformation into the acceleration phase. During this phase, your symptoms are generally low-grade fever, night sweats, bone pain, weight loss, and you have easy bleeding or easy bruising due to the dysfunction of placements. This phase is relatively short and it only lasts about 6 to 12 months. And then when you move into the terminal blast crisis phase, it's an evolution to acute leukemia, and it's characterized by an increased number of myeloid precursors, especially blast cells in the blood. Symptoms become more pronounced during this period, and splenomegaly may increase significantly. There's a very high blast count, and symptoms of leukostasis may occur. For those who are in the blast crisis phase, it's poor, and just the median survival is 3 months. As for diagnosis, there is an elevated blood count with a median count of 1,500,000. You can see the presence of that Philadelphia chromosome that we talked about, which is also called the BCR-ABL gene, which is just the parts that are flipped. And then there's a bone marrow aspiration with the cytogenic analysis that's required to figure out like which phase you're in, and like whether you're in the chronic acceleration or blast phase. And it's also used to identify chromosomal abnormalities that are not detectable by using this form that's like up in the corner. It's called like a FISH test, and it uses just like fluorescent lights to look at your chromosomes. As for treatment, there's inhibitors for the BCR-ABL. It's called oh man, sorry, we're in the same boat trying to pronounce that one. But it induces complete remission in a high fraction of people with stable phase chronic myeloid leukemia. But that's still kind of in the testing phases. So the only available treatment at the moment is an allogeneic bone marrow or stem cell transplant. As for quiz questions, that's the end of the presentation. As for quiz questions, the first one is, what is the name of the chromosome associated with chronic myelogenous leukemia? Give you a minute to look at that. And then the next one is, which form of leukemia is most common and what percentage of cases does it account for? Give you another minute to look at that. These are my references. These are my written references. These are pictures. At the end of this is the answers to the quiz. So I don't know if Dr. Holt wants to show that to you, but I just won't progress, or I will, just don't look. Okay. There you go. That's the end. Thank you.